Alright, for this video, we're going to establish an intraosseous injection on a pediatric patient. So once again, as we get started, we need to look at what we need for supplies. So as we do this procedure, we're going to we'll need alcohol to clean the injection site. We're going to need the actual device. So we have the Jamshidi or the EZ-IO drill. Today I'll be using the EZ-IO drill. We will also need an extension set, a saline flush, some tape to secure, bulky dressings, as well as the fluid. So if we're going to be bolusing our pediatric patients, our normal saline, and the appropriate extension set. And then last but not least, my BSI. So we're going to go ahead and I'm going to put on my BSI on at this point. I'm going to go ahead and select my appropriate fluid. So I now have my normal saline. I have a 250 milliliter bag that I'm going to open up. I'm going to grab the appropriate extension set. So a lot of what we'll see are these Biratrel sets. A Biratrel set allows us to put a certain amount of fluid into a chamber and then release that fluid into the patient. That way we have a pretty precise measurement of how much fluid we're administering. We could also use our 60 drop extension set, which is what I'll be using today. So I'm going to go ahead and open up my extension set, or sorry, my drip set. I'm going to look at it and make sure that it's not discolored. Everything looks the way it should. And then I'm going to take my roller clamp and move it up towards the top, towards that drip chamber. And then close off the roller clamp. Just like starting an IV, this needs to be done as a sterile procedure. So when I remove these covers or these caps, make sure that I don't touch them. So I'm going to go ahead and insert the spike into the bag, twisting motion. It should seat, and then we can go ahead and flip it over. All right, I'm going to go ahead and give it a couple squeezes to fill this thing about half full. If something happens and I go a little fuller than half, easiest way, right, just turn it over and squeeze it back into the bag, and we're now set at about halfway. So I can hang my bag, and I'm going to flush the line by opening the roller clamp and letting the fluid run through the line. Okay, as it runs, make sure you're watching it so that we don't have air trapped inside of the line. And we're almost there. Alright, so I'm at the end, so I'm going to close my roller clamp, and then I'm going to verify on my line that I don't have any air in there. Alright, so now that my bag is set, we're going to go ahead and get ready for the rest of the procedure. So as I prepare my equipment, I'm going to go ahead and open my extension set and my saline flush. On the saline flush, just like on the bag, I want to make sure that it's the appropriate medication, that it's not expired, and that the medication looks good, it's clear, nothing wrong with it. So anytime we're administering medications, make sure we're checking that. I'm going to attach this to the extension set. And then I'm going to flush the line. Okay, now once all the air is out of the line, you can go ahead and set that aside so that we're ready to go. I'll typically set it back on that piece of plastic, so that it stays clean. Alright, I'm going to go ahead and cut some tape. We're going to need some strips that are about 6 inches in length for when we secure it. And I'm also going to open up my bulky dressings. I'm going to use some 5x9 dressings to go ahead and stabilize it when we're done. Alright, so for today I'm going to be using the EZ-IO drill. So I'm going to go ahead and find my site, and then I will prepare the drill. So as I look at the site, I'm going to find the tibial tuberosity. It's that little bump right below your knee. When you find that tibial tuberosity, we're going to go ahead and go 2 finger lengths or widths down and come to the medial aspect. You should find a nice flat spot on the tibia. That's the spot we want to hit. Okay, once we've identified that site, I'm going to go ahead and clean it. Once again, aseptic technique. Okay, once it's been cleaned, we can go ahead and let that dry for just a moment. While it's doing that, I'm going to get my drill ready. So with the EZ-IO drill, I'm going to want to make sure that I grab the pink pediatric size needle and then the drill, and it'll attach with a little magnet so that it's all ready to go. Alright, so as I stabilize the leg, I'm going to want to make sure that I don't wrap my hand around the bottom side. Right, whenever we stabilize, we can use a towel roll underneath, otherwise we can grab below it and pull gentle traction as I pull down to help stabilize that bone. I just want to make sure once again that I don't cup underneath it and drill. So as I stabilize the leg, I'm going to go ahead and advance the needle until I hit. Go ahead and drill. It'll drill into place. You'll feel it kind of give. And then we can go ahead and pull the drill off. I'm going to go ahead and unscrew the top of the needle. That's going to come out and go into a sharps container. And then I will attach my extension set. Alright, once I have the extension set on, I'm going to go ahead and aspirate by pulling back, looking for a return of bone marrow into the line. Now we know that 50% of IO sticks can be what they call dry sticks, so I may not get a return of marrow, and that's okay. It doesn't mean we didn't do it properly, it just means I didn't have marrow, and when I flush, I'm going to want to make sure to watch the surrounding area, watch the tissue to make sure that we didn't have any, or that we don't have any infiltration. So we flush the line. I don't see any signs of infiltration. So I'm going to go ahead and make sure we leave the extension set in place. And I'm going to add just a small piece of tape onto that just to secure the extension set. Alright, so now at this point we've injected. I'm going to go ahead and attach my fluid. And once again, because I've touched it, I'm probably going to want to clean this with alcohol just to make sure that we're not contaminating anything. So we're going to attach that, and then I'm going to open up my fluid. And once again, I'm going to bolus in, and I'm going to watch the fluid, making sure that we don't have any infiltration. If we're bolusing a pediatric or bolusing fluid for a pediatric, remember we use that 20 milliliters per kilogram. So we identify the weight, and then multiply that by 20, and that's our fluid level, or how much fluid we want to bolus. Alright, so at this point I'm now ready to secure it down. So I'm going to take my bulky dressings, and in order to secure the needle, we're going to go ahead and secure our needle and our extension set. I'm actually going to come underneath here. Okay, as we secure, we want to be very careful that we don't wrap or come all the ways around the extremity. Right? We never want kind of tape touching tape. As we come around, I don't want to create a constriction. Okay, once again, make sure that we don't have our tape touching tape. We're not losing, or we're not causing any constricting effect. And that would be it.